name is Kiara St. I'm the Executive Director of New York Transgender Advocacy Group. We are a trans-led agency that addresses policies and how policies have impacted trans and gender nonconforming folks throughout New York City, New York State, and beyond. We are an agency that is committed to really making sure that we are centering and developing the leadership of trans folks throughout New York City and New York State. So I have been involved in activism in New York City for over 20 years now. First starting in the 90s, addressing discriminatory policies of trans folks, specifically trans women in the shelter system. New York Transgender Advocacy Group was started because I saw the connection between health equities, like when you talk about HIV infection rates, when you talk about homelessness, when you talk about the high unemployment rate. I saw a connection between that and policies, and how when there are no policies that affirm us and that protect us, it creates this disparity that we are seeing not only in New York City but globally. One of the major reasons why I was passionate of working with my community members in creating New York Transgender Advocacy Group is because although we're located in New York City and there are a lot of support groups and so-called empowerment groups, what I found is that they were not led by trans folks and they were not led by trans folks of color. 2017 was a very productive and strategic year for NYTAG. Starting out with our second annual community coat drive, where we serviced over 50 community members. That was a really great way of holding space with community members and touching on issues that are impacting our community. In the month of February, we're going to be having a name change workshop because we recognize the importance of assisting community members with getting their name changed. These are ways that they can start navigating and giving them the tools they need to navigate with the minimum amount of trauma. And it starts with really educating them, bringing in professionals who are licensed and have experience and background in name change. We also want to make sure that we are engaging with our academic community and that we are able to compensate them to do trauma-informed care workshops. So one of the things that I feel is really important about New York Transgender Advocacy Group is that we are not just a New York City focused advocacy group, but we are also an agency that have chapters in the process of being created in other parts of New York State, such as Binghamton, New York, where there's been a great response and request for NYTAG to help support them in access to health care, public health accommodations. Those things are of critical need in a lot of our rural areas. Just really want folks to understand, we understand how systems are not broken, but we want to make sure that we're creating new systems that are affirming and inclusive.
It is our duty to fight.
It is our duty to fight.
It is our duty to win.
It is our duty to win.
We must love one another.
We must love one another.
We must support one another.
We must support one another.
We have nothing to lose.
We have nothing to lose
but our change.
but our change.
Ashe.
Ashe.
Thank you so much, everyone.
Welcome to today's program, and thank you for joining us. I am C. Virginia Fields, former Manhattan Borough President and current President and CEO of the National Black Leadership Commission on AIDS, Inc. Mission of the National Black Leadership Commission on AIDS, also known as NBLCA, is to educate, mobilize, and empower Black leaders to meet the challenge of fighting HIV/AIDS and other health disparities in their local communities. On today's program, we have the opportunity to speak with the founder of the New York Transgender Advocacy Group. This network of trans men and women and allies work to advocate for the needs of the transgender community across the country and here in New York State. So to discuss this topic is Kiara St. James. Kiara St. James has been a community organizer for some 20 years. She has traveled the world to attend many global forums as a policy and human rights advocate, speaking on trans community issues related to discriminatory shelter policies, discriminatory pharmaceutical actions, and specifically here in the United States, as a vocal advocate for passing of the Gender Expression Non-Discrimination Act, known as GENDA. Kiara is the founder of the New York Transgender Advocacy Group, which is an organization intent on creating new opportunities for persons of the trans community. So Kiara, thank you so much for joining me today.
Thank you for having me.
And I know that there are just a few statistics that I'd like to highlight, because as we were preparing for the show, I was pretty much taken back by them. In a couple of statistics that show that the average life expectancy for a Black transgender woman is 35 years.
of age. Absolutely.
And a 2014 report from the Williams Institute states that there are over 15,000 transgender individuals serving on active duty in the United States military, and there are over 134,300 transgender veterans. And according to this data, 32% were assigned male at birth and 5.5% were born females.
Absolutely.
And I think that focus on the military is certainly important because of what the 45th has proposed with respect to transgender persons. Another report analysis this year by the Williams Institute also found 78% of transgender respondents who had endured physical or sexual violence at school had attempted suicide.
That's right.
Our young people attempting suicide. And the Injustice at Every Turn survey states that 25% of transgender recipients reported losing a job because they did not conform to gender norms. And a staggering 90% said that they faced some form of transgender-based discrimination.
Right.
And lastly, right here in New York City, according to the New York City Department of Health and Mental Hygiene, from 2012 to 2016, 236 transgender people were diagnosed with HIV in New York City, and 56% were Black or Latino people ages 20 to 29. Right. And those numbers are very consistent with the numbers of African Americans being disproportionately impacted by HIV/AIDS, Black gay men, men who have sex with men, and of course heterosexual Black women are almost 66% or so of all of the new infections among all women.
Absolutely.
So, Kiara, welcome.
Thank you.
And thank you for being a guest again, because you were a guest back in 2015.
Yes.
Seems like it was yesterday,
Yes.
but
Time
3
flies.
years have passed. Right. So
Absolutely.
welcome back. And
Thank
of course,
you.
NYTAG has been doing quite a lot.
Yes.
You've grown. Now you have a program that you're starting up, and a great deal of work continues to focus on the transgender community. So we really wanted to spend some time just to get some highlights or some updates in terms of where we are, and for you to tell us a little bit more about the work and the progress of NYTAG.
Absolutely. Well, thank you. And the data that you just reported on is one of the main reasons why I felt there was a need for an organization such as NYTAG, led by trans folks, to really start being the folks to really address how these policies are impacting us, or the lack of policies that would be able to give us recourse under the law. So GENDA is another important legislation that we need to make sure that we are continuing to build coalition around. And so that's something I'm going to be pushing with a state coalition over the next year, especially since this is a midterm election year. So the data speaks to why there's a need for trans-led agencies, specifically led by Black trans women. The life expectancy of Black trans women is 35 years of age.
35 years of age.
35.
Well, what is the, if that's known, the average age that a person begins to trans?
Mm-hmm. So it varies, it depends. For Black and Latina trans women, we tend to transition much earlier, 16, 17.
Okay.
And that is one of the main reasons why there is a higher homeless population amongst Black and Latina trans folks, because a lot of us come from very religious households. I come from a Church of God in Christ background, and so being anything but the binary gender of male or female was not accepted. So I had to, I was put in foster care because of that reason.
So, for example, if the average age, say 17, living as a transgender woman would be life expectancy of 18 years, with the life expectancy being 35 years in terms of life. So if one came out or began to openly live as a transgender woman at the age of 18, I'm sorry, 17, that would be 18 years of life living as a transgender person.
Absolutely, and it's
and
not
of course,
equality.
if it's later, 20 years old, it's even less.
Absolutely, and it speaks to why we have to not just cultivate relationships with our elected officials, but with faith-based leaders, getting them involved in creating affirming spaces for trans youth. That's going to be very essential. Making sure that we are making sure the schools, we do have a policy called DACA, Dignity for All Students, which is an anti-bullying law. So we really want to make sure that it's enforced and that there's ongoing cultural sensitivity when it comes to the needs of the trans youth in our New York City school system, as well as statewide.
So in your work, what would you say, and it may be difficult because I guess there are many issues, but what are some of the most important and critical issues that you find in your work in terms of trans women, especially Black trans women, experiencing and speaks to the need to do more?
Right. So there's this term called trauma-informed care. So it speaks to the need of more mental health and really stressing wellness and getting trans women of color to really give them the tools they need to navigate where they're not triggered by misgendering, they're not triggered by being denied access to services. What happens when trans folks are come across any type of misgendering, it's a shutdown where their anxiety builds up, and what you'll find is a lot of Black and Latina trans folks isolate, not just women, but men folks as well. We do have a substantial trans male identified population, and so what you find happening is, what I have found happening is there's a shutdown, a belief that the system is not for them, and so they isolate, and that is not good because we want to make sure that our community members have access to the same things that cisgender folks have access to.
And what often leads to the misgendering? You spoke about a lot of it, misgendering, and persons begin to just sort of isolate themselves. So
it's biases that are, it can be cultural biases, it can be due to religion, and so
it's, some of it is intentional.
It's intentional.
Misgendering.
And absolutely, and misgendering is a form of violence, so what we're talking about is structural as well as social violence, and we have to address that. We need to make sure that New York City as well as New York State is doing a better job of educating their hospital staff, because it still happens within hospitals, rehabs. There's a lot of trans folks, because of the various health drivers out there, they are denied access to rehab.
So talk a little about transgender population, and especially again Black women, and HIV, because we all know HIV does not stand alone. So when we look at other issues that are being addressed by transgender persons, and we add on HIV, hepatitis C,
Absolutely.
that becomes...
Yeah, so I always tell folks, I like to start out talking about generational trauma and how it shows up in our communities. And so one of the things that folks have to understand is that folks don't intentionally go out, well, I shouldn't say most folks do not go out intentionally acquiring HIV. It comes from the lack of support from family, then lack of support from resources such as high schools, shelters. And we really want to make sure that we're creating not only an affirming and inclusive space, but we're giving our community members the tools they need to be productive citizens. Nobody wants to stay at home and just, you know, be a burden to society. It starts with making sure that there are opportunities that we're all afforded.
Now, you started talking somewhat about your own experiences, and if you don't mind to go back to that in terms of how you grew up, especially in a church-related environment, and how you more or less move forward and can offer some recommendations to especially younger people, since we saw the numbers that spoke to suicide. I think it was significant number of young people who attempted suicide.
Yes, very high.
Yeah, that younger age. So tell us a little bit more about your experiences as you have related them in the past.
Yeah, so I grew up in Beaumont, Texas, Church of God in Christ background. Due to a lot of gender policing, I found myself in foster care due to the fact that I was, my father did not find it acceptable to have a child that was very feminine. I'm one of 6 children, so finding myself into foster care, finding myself pretty much given opportunities to travel, and then coming back once I graduated from high school. I was...
You went back to Beaumont, Texas?
I went back to Beaumont, Texas, then I found that that was not quite where I belonged, so I was seeking community.
And how old were you then?
So I was 17 when I graduated from high school.
Okay.
And then from there, I went to Gary Job Corps, which is located in San Marcos, Texas. From there, I got a certificate as a nurse assistant, moved to Atlanta with my partner. From there, we moved to New York City, where I found it very hard, especially in the 90s, to find a job, even though I did have qualifications that said that I was qualified. And so what I found was a New York City that had no protections for trans folks. So it was a very lively time, but a very scary time to be trans in New York City. Finding myself in a shelter system where they had the right to deny you access to a bed if you look too feminine. So that happened to me and a lot of community members for a long time. I found this organization called Positive Health Project, which is still in existence today, and they were one of the first trans organizations that really catered to trans women of color that was able to do one of my first political mobilizations. I told them about the discrimination I faced in the shelter system, and they did a phone zap where the next day I feel like it was a change, because the shelter realized like I had a community that supported me and backed me up. And so that really made me realize like, wow, I need to get more involved and mobilize my community and understanding how policies, like we have policies that we can start working on, and like if we can like just mobilize and build a coalition, we can really have our concerns met. And so over, like since the 90s, I say 2002 is when we have our first law that protected trans identity in New York City. And I really feel that since then, we've been seeing a lot of progress. We still have a long ways to go, but there's a lot of progress that's been made.
But clearly you've been in the forefront and a part of all of those experiences, so when you speak, you know from which you come. You know about what it is like to be discriminated against and to be unemployed. And now I think that's phenomenal because, you know, so often, and I see it all the time, people speaking on these issues, and especially people in public life, they don't talk to persons who are from those experiences, whether
Right.
it's racially, sexual orientation, or other factors that might define a person,
Absolutely.
to help them understand why it is so critical to have laws passed and policies that support the needs of the population.
Absolutely, and especially Black and Latina trans women, we really need to make sure that we are making a committed effort to get involved and learn about policies, because a lot of these policies are going to impact us. And so I am a true believer of having a vision for our community to where we don't need permission from allies to say this is what we want to have agency over our lives. So whether we're talking about reproductive justice or going to school, we have a right to have a say-so in how policies are going to affect us.
And I think you also spoke earlier about the need for the beloved community to
Yes.
come together, and that, of course, touches upon all of the many different people, institutions, and so forth within a community. So what would you say in terms of how the conversations need to change so that we can bring the community together and make discussions around transgender persons as much of a part of those conversations as we do now for MSMs and the gay community?
Absolutely. It first starts with having intentional conversations, you know, making sure that the concerns of both communities are being addressed, you know, because if we are to truly dismantle patriarchal white supremacy, we have to come together and not let these minor differences keep us like divided and like, oh, well, you have no clue of what I go through as a cis Black woman. When we have a lot of the same issues, you know, and like making sure that our faith-based leaders understand they play a pivotal role in creating affirming spaces for trans folks and gender non-conforming folks to have a say-so.
And do you see a change occurring in those areas with the faith-based communities especially?
Absolutely. I see a lot of the work, especially that NBLCA has been doing. I've been very privileged to also be invited by NBLCA to be part of those faith-based panels to talk about how we can do a better job working together. You know, one of my favorite quotes from the New Testament is, "And to the eunuchs I give names greater than sons and daughters." And that speaks to there's a place for trans folks, gender non-binary folks in the faith-based community.
And I think that, you know, those discussions, again, are incredibly important. And I think I saw somewhere that there's a schedule coming up where there are going to be more of those discussions.
Yes.
And I would agree with you to the extent that we can bring people together. I remember it was President Barack Obama on one of his World AIDS Day presentations. He said, all hands must be on deck.
Yes.
So that spoke, for me, it spoke to everybody
Yes.
who is concerned, want to be concerned, need to be concerned,
Right.
especially in the Black community. We cannot isolate and say, okay, we're not concerned about all that because Black people are transgender people.
Absolutely. I always let folks know I'm Black, identified before I'm anything. So I lead with my Black identity before I lead with my trans. So it hurts me a lot of times when I'm in Black spaces and I'm not received as a community member who happens to be of trans experience, you know, and so really making sure that we continue having dialogue to talk about, like, we are part of the same family. You know, I think they're saying we're one body with many parts.
Absolutely.
And so just really making sure that no one is left behind in these conversations we're having.
And before we close, I want to just ask you to speak a little bit more because this is something that we're experiencing certainly at NBLCA. And we're very pleased to have a partnership with NYTAG in terms of doing our work. How is it that we have not been able to make more progress, especially with the number of trans persons we have seen, say, over the last year who have been killed? And there still has not been enough, seemingly, outcry, I think,
Right.
from the broader community.
Absolutely.
So what can we do now?
Yeah.
here
Yeah.
in New York City. Let's talk New York
New York
City right now.
Absolutely. Yeah, there has been that disconnect that has always been like a thorn in my flesh. You know, we need to make sure that we're investing, like how we can minimize the murders and violence that we're seeing is invest in trans communities here in New York City, making sure that we're talking about creating job opportunities. You know, we're talking about making sure they have mental health, because a lot of these things come from the fact that they do not have a connection to like organizations that can help build their skill set up.
Right. Okay, so before we close, let everyone know how they can reach your organization, because obviously there's a wealth of information in the work that you've been doing that needs to be known. So just help our people know how they can reach your organization.
So yeah, they can reach me at Kiara@NYTAG.org. Also, we have a website, NYTAG.org, that folks can reach out and inbox me and my staff to, if they need for us to come in and do some type of training, medical provider training, do any type of workshops around financial literacy. We do it all. So that's one of our main purposes, is really to make sure that folks have the cultural sensitivity training that they need to better serve trans folks in New York City.
Well, I certainly want to thank you again for coming back
Thank
3
you for
years
having
later,
me.
since
Yes.
2015, and I want to thank you for joining me today. And you can learn
Thank you.
more about NBLCA by visiting our website at NBLCA.org. And also look for NBLCA on Facebook, Twitter, Instagram, LinkedIn, YouTube. And the Manhattan Neighborhood Network brings these programs to you and your family to better inform you, the viewer, about the important topics that impacts your health and well-being. So please let your family, friends, and neighbors know about this programming. Again, I am C. Virginia Fields, and I thank you for joining us, and hope you will tune in the next time for NBLCA's Health Action TV right here on Manhattan Neighborhood Network. Thank you.